Let's talk telehealth. So, with the COVID era that we're facing right now, I'm sure everyone's just loving the fun times it's brought. We've really moved over to a telehealth platform in a lot of ways, um, not only to kind of accommodate for like the social distancing and protecting people's health from COVID, um, but there's also been other benefits to it. It's kind of a pros cons thing, much as anything is. Um, my experience with telehealth has been positive overall. We do both our groups and our individual sessions over telehealth. We're moving more back into office now. However, we do still do offer telehealth. Some of the pros I think for telehealth is convenience. A lot of people don't have the resources to always get to therapy, so being able to like meet on your phone screen is really helpful. You don't have to take so much time off work, driving, gas, all that stuff. So I think it's can be really resourceful. I also think that we still provide good treatment. I think we're still able to build connections with our clients, and we're able to still do a lot of interventions over telehealth. I also think that there are some downsides to it. As someone who thinks that they're like, I really believe strongly in like we're building a relationship with each other, right? My job is to be able to be there to support you and to help you, and in just you making progress and moving forward the changes that you're trying to make in your life. That's kind of how I see my role. You don't come to me for me to fix you. You're not broken. So I think there is a certain personal connection that's maybe not there quite as much over a phone screen, even though it's video and we talk to each other and see each other, right? It's just not quite the same as being in person. I also think that there are certain interventions and therapies that just maybe aren't as effective. For example, doing like trauma-based treatment, which is going to be a lot more intensive and kind of getting into some really yucky stuff that you've experienced or had to overcome. And I think sometimes being able to do that in person has more benefits than doing it over telehealth. There's also like a safety thing. I think sometimes it's a little bit harder to gauge how someone's really doing over the phone screen. It's harder to read body language and some of that stuff. So there's some cons, I think, in that regard. Beyond convenience, I also think it's really great in terms of being able to kind of like, oh, I'm at home and I have time to hop onto this group, or I just got out of work, I can go sit in my car and do telehealth, right? That convenience aspect is there. But with that, I think can come distractions. I know I've been distracted during sessions before, especially if I'm working from home. I can hear my kids or kids somewhere upstairs, and I think it can be the same for clients, right? Is they can kind of get distracted. Also, there's just that lack of privacy maybe sometimes if you're doing it at home or where other people are around. Sometimes maybe we don't feel as open, or we don't feel as safe to be open and kind of talk about some hard things, or maybe we're having struggles with somebody in our home. We don't really want to talk about it because we're like, oh, maybe they can hear me, right? And so I think there's definitely some concerns and some things that might feel like barriers. But with that, there's also ways to work around them. I've had people just get off work or go meet in their car, or they go for a drive and we just meet, like they telehealth from their car, and so they have privacy. So I definitely think that there's pros and cons with telehealth, and these are things you're going to see with any telehealth service. I'm sure it's the same with physicians as it is with therapy. We're just working with something that's a little bit different. So that's my thoughts on some telehealth pros and cons.